What is the Affordable Care Act? The Patient Protection and Affordable Care Act was signed into law on March 23, 2010. The law was amended by the Healthcare and Education Reconciliation Act. The final law became known as the Affordable Care Act, also known as the ACA. The focus of the law is to help make health insurance affordable, expand coverage, control healthcare costs, and improve public health and the healthcare delivery system. In this next section, we will discuss BACA, before the Affordable Care Act. Before the Affordable Care Act, issues with health insurance were many and complicated. There were many barriers that existed in the current health insurance system. Many people were uninsured. Access, affordability, and adequacy of coverage was not available for all consumers. Private insurance was expensive, and consumer protections were limited. In this next section, we will explain how the Affordable Care Act helps all. The Affordable Care Act expanded eligibility and coverage, and it offered new patient protections for coverage. As a result, low-income single adults now qualify for Medicaid in many states that they before did not qualify. Those with incomes that are too high for Medicaid can get new premium tax credits. People can now apply online and verify information electronically, and private insurers cannot deny people coverage or charge them more because they have a pre-existing medical condition. Please take a look at some key dates of the Affordable Care Act. In conclusion, the goal is simple. Simply put, the goal of the ACA is to ensure qualified health coverage for all. How is this goal measured? I'm glad you asked. By January 1st, 2014, almost all individuals, U.S. citizens, and legal residents must have qualified health coverage. And by January 1st, 2015, employers with more than 50 employees are required to offer health insurance or pay a penalty. And this concludes my presentation today on the Affordable Care Act. Thank you for listening. Respectfully submitted by Jana Freeman.